Hello, my name is Melissa Melnitzer, and I'm a MAID assessor and provider in Ontario. I'll be speaking to what the MAID application process looks like in Ontario. To arrange an assessment for MAID eligibility, you can talk to your clinician or call the Provincial Care Coordination Team. This team is run by the Ontario Ministry of Health and can be reached at 1-866-286-4023. When you call care coordination, you'll speak to an intake nurse who will ask you questions about your medical conditions, as well as general information such as your date of birth, OHIP number, and address. From there, they'll look to find an assessor, a doctor, or a nurse practitioner in your area to meet with you for your first assessment. This can sometimes take a couple of weeks or longer to coordinate. People who are imminently dying, such as those with late-stage cancer, may be triaged and prioritized. If your situation is especially urgent, it's important to mention that to the intake nurse. In Ontario, you can call care coordination yourself, or you can ask a family member or friend to make the initial call for you. After you contact care coordination, a MAID assessor will contact you directly. Depending on your situation, you may need to request medical records from your primary care provider before meeting with your MAID assessor. Medical records in Ontario are not all stored in one place. This means that clinicians may not be able to see your records without being sent them by you or your healthcare providers. If you prefer to speak to your own doctor about MAID, that is an option. The College of Physicians and Surgeons of Ontario has an effective referral policy that indicates that even those who object to MAID or do not provide it themselves must make a timely referral to a clinician or agency who can assist the patient. For MAID in hospital, if you're an inpatient at a hospital, you can ask one of your healthcare providers for information or for an assessment. This could be the physician in charge of your care or another practitioner, such as a social worker or nurse. If you run into any issues getting the information or assessments that you are asking for, you can speak to the patient relations or patient experience team. Further, Dying with Dignity Canada is available to talk through any access issues you may encounter. For written requests, everyone who applies for MAID must complete a written request. If a person is unable to sign the form themselves, another person, called a proxy, can sign on their behalf so long as they meet the criteria in the law. The person needs to have capacity to consent at the time of the signing and must give consent to the proxy to sign on their behalf. The requirements for proxies, those signing on the applicant's behalf, if the applicant is physically unable to sign, are that the proxy must be at least 18 years of age, understand the nature of the request for medical assistance in dying, not know or believe that they are a beneficiary in the will of the patient making the request, not know or believe that they are a recipient of financial or material benefit resulting from the patient's death in any other way. The form also needs to be witnessed by one independent witness. Any person who is at least 18 years of age and who understands the nature of the request for medical assistance in dying may act as an independent witness, except if they know or believe that they are a beneficiary under the will of the person making the request or a recipient in any other way of a financial or other material benefit resulting from that person's death. Or if they are an owner or operator of any healthcare facility at which the person making the request is being treated, or any facility in which that patient resides, or if they are an unpaid caregiver. If you're struggling to find a witness or proxy for your form, you can contact Dying with Dignity Canada by emailing witness@dyingwithdignity.ca or call the toll-free number 1-800-495-6156. Clinician Aid a commonly used request form, can be found on the Dying with Dignity Canada website or the Government of Ontario website. You can fill in your form either before or after your assessment. It's best to ask your provider or the care coordinator what their preference is. After the form is completed, hang on to it and keep it in a safe place. Your MAID assessors will ask to see the form during the assessment process and may take it with them at that point. There's no need to submit it anywhere. In most cases, the assessment process looks like an interview. Clinicians will ask to understand how your conditions have affected your quality of life. They will have read through your medical history ahead of time, but may ask some clarifying questions about treatments you've tried, how long you've experienced various symptoms, and so on. The clinician may ask to do a physical examination in some cases. Most assessments involve 2 separate meetings at different times, one with your primary assessor and one with your secondary assessor. You are generally welcome to have a family member or friend with you during your assessment, but the assessor may also request some one-to-one time just with you. In terms of the actual provision of MAID, this can take place at home as well as in hospitals, hospices, and long-term care homes. However, some institutions have opted out of providing MAID. There have also been some funeral homes in Ontario who have spoken out publicly about the spaces they have made available for the procedure. Some people have special requests when it comes to their MAID location. MAID providers try to accommodate these requests as often as possible. At the provision in the home setting, it's usually just the provider and whoever the patient wants there, such as family or friends. An IV nurse may arrive a few hours before the provision to insert the IVs and ensure they're working properly, or they may insert the IVs just before the procedure and be there through the procedure itself. In a hospital setting, there may be additional healthcare professionals present, such as social workers and spiritual care supports.